Good morning. Today we are making a video on opening and closing the dental office.
Okay, so the first thing that you would do to open the office would be turn on the master switches, which is the air compressor and the vacuum system. Now we're going to go to the reception area. In the reception area, we're going to unlock the door, turn on the lights, straighten the magazines so it can look nice. Okay, now we're in the business area. We are going to answer or check the messages, see if patients called, turn on the computer just to check the patients, unlock the cabinet for the files, and organize the business area. Just make sure it's clean and nice. And then we're going to do copies of the patient schedules, and we're going to post them in the different treatment rooms. And that's it. Okay, so after we're done with the business area, we're going to come to the processing lab, and in here we're going to replenish any solutions that need to be replenished and change the water of the processing tanks. Okay, so after leaving the processing lab, we are going to change it into our clinical clothing, which is followed by the OSHA guidelines. And we are also going to check the patient's schedule just to see what they're going to have on for today. So after we check the patient's daily schedule, we are going to prepare the treatment room for our first patient. We're going to check for any supplies, put barriers on, check if the water service has water. Okay, so we are going to check the chart, review it for the patient, and we're going to set up the trays and any lab work that they need to be done. Okay, so after the treatment room, setting up the treatment room, we're going to come to the sterilization room. The sterilization room, we are going to check the solution levels, and we are going to have new ultrasonic and disinfectant solutions as well. And we are going to prepare any instruments that need to be done for the overnight sterilization. This is opening the dental office.
Ms. Ramos, we're ready for you.
Okay.
Follow me right this way. We're going to be in room number 1.
Which way?
This way. Place your stuff on the chair right there.
Okay.
Take a seat. Okay. Has anything changed in your medical history?
No,
Are you still on the same medications? Anything new?
no, nothing new.
All right. Okay. Put a bib over here. All right, Ms. Ramos, we're going to take your blood pressure now.
Okay.
I'm going to need your left wrist. And if you could please move your sleeve up. Thank you. Okay. And place your hand over your chest and cross your legs, please. Okay. Okay. Perfect. 120 over 80.
Okay. Is that normal?
That is perfectly normal. Okay. Now I'm going to give you these safety glasses, okay?
Okay.
Here you go.
Do I need to take off my glasses?
Yes. I'll put them over here for this on the side.
I can hold them.
Okay. And let me go see if the dentist is ready, okay?
Okay.
Okay, just to let you know, what we're going to do again is we're going to do amalgam on number 19, and that's your first premolar, or first molar on the bottom.
Okay.
Okay?
How are you today?
Good. Scared.
No, it's not gonna hurt. You might feel some discomfort. Thank you. All right. Alright, so when you dismiss the patient, you want to make sure that you evacuate the patient's mouth. Also, remove any debris that is on the patient. And if you'd like, you can let them look in a mirror. And also, you want to make sure to move the light out of the way. After that, you want to remove the bib and place it on top of the tray that you just used. The next thing is to remove the saliva ejector tip, the air water syringe tip, and the HVE tip. And you'd also want to make sure that the operator stool and the rheostat and the control panel here are moved out of the way. Then you'd want to move the patient up, let them get out of the seat. And just being lifted up.
There you go.
Thank you. I'll take those. I know you want to keep these.
I did.
Alright, you can follow me this way to the front and we'll check you out.
Okay. Yes. Okay. Okay, thank you. Have a good day too. Bye-bye. Hi, Ms. Ramos. How was everything?
That's okay.
Do you need a follow-up?
No.
No?
Just one of those little cards.
Good morning. I am going to demonstrate on how to close the dental office. The first thing we're going to do is clean the treatment rooms. But before doing so, we will put on our utility gloves to protect our hands. We'll do an in-depth cleaning of the dental chair and the unit. After doing that, we will flush the handpieces and the air water syringes. We'll run the solutions through the evacuation hoses, and we'll clean the traps and the filters and maintain the water reservoirs. After cleaning the dental treatment room, what we're going to do is we're going to put the dental chair into the right position for housekeeping. After cleaning the dental treatment rooms, what we're going to do is come and turn off the master switches. After turning off the master switches, we're going to come into the processing lab and we're going to mount, file, and process any x-rays that need to be done. Okay. After we file and process and mount any of the x-rays that need to be done, we're going to follow the manufacturer's instructions to shut down the automatic processors. And then we're going to turn off the water supply tank to the manual processing tanks. After turning off the tanks, we are going to wipe the counters, but before wiping the counters, we will put on our utility gloves. We'll wipe the counters and then turn off the safety lights. Next, we will come to the sterilization room. What we're going to do is we're going to sterilize any instruments that need to be sterilized, and then we're going to set up trays, like so, for the next day. Then we will empty the ultrasonic solutions, turn off all equipment, and we're going to stock all the supplies necessary for the next day. So we just left the sterilization room, and then what we're going to do is we're going to make sure that all the laboratory cases have been sent. The next thing that we will be doing is we're going to confirm and complete the appointment schedule for the next day. Next, we will complete the insurance forms and the responsibilities. We will complete the daily bookkeeping responsibilities, and we're going to pull charts for the next day. Next, we will turn off all the business office equipment, for instance, the computers, and then we're going to turn on the answering machine. After this, we will lock up the patient charts. After closing the business office, what we're going to do is we're going to come into the reception area and we're going to straighten everything up, make sure it looks nice for the next business day, and then we're going to lock the windows, lock the doors for security reasons. I have just locked the windows and the doors for security reasons, and now I'm going to change from my uniform to street clothes, following OSHA guidelines. After changing into my straight clothes, what I'm going to do is I'm going to turn off any equipment in the staff lounge, wipe the counters, and clean the tables. Now this completes the closing of the dental office suite, and I hope this helps you out. Thank you.
Stuff on the counter there.
Okay.
Okay, this is a mess.
And now document. Oh my god.
Good morning. Today we are making a video on opening and closing the dental office.
Okay, what am I gonna say again?
Okay, so change it before going. Change into your appropriate clinical.
Okay, I
clothing.
got it. Okay, go.
Oh, we've been recording.
We are going to change our clothing, our clinical clothing, into I don't know. Okay, so after the treatment room, we're going to come to the sterilization. Oh, okay. Okay, so in the sterilization room, we are going to check the levels of the check the levels of the what?
You're gonna.
Room, and we're going to do an in-depth cleaning of the treatment room. The complete, whatever. She can edit that. This completes the